The Special Committee on Aging will examine troubling problems, and that's an understatement, in the nation's nursing home inspection system and receive testimony about the urgent need to invest in oversight to protect nursing home residents' health and safety. Last year, I directed my staff on the committee to investigate the capacity of state inspection agencies to enforce health and safety standards in the nation's 15,000 federally certified nursing homes. Today, I'm releasing the findings of that investigation in a report entitled, I'll hold it up just for illustrative purposes, Uninspected and Neglected, and the subheading is Nursing Home Inspection Agencies are Severely Understaffed, Putting Residents at Risk. This is based upon 2,000 pages of documents and data provided by every state in the nation. The report paints a picture of a system in crisis. Underfunded and understaffed state agencies have fallen behind on the basic duties that they're charged with executing on. For example, conducting annual nursing home inspections and responding to resident complaints in a timely manner, as nursing home residents and their families should have a right to expect. As we'll hear from our witnesses, the result is that nursing home residents are at risk because of this problem. Just imagine the horror of an 84-year-old woman whose leg was broken at a nursing home in Pennsylvania, but a full week passed before she was taken to a hospital where she later died. The county coroner cited negligence as a contributing factor in this woman's preventable death that occurred one day before her 85th birthday. Often such stories aren't the subject of public attention due to inadequate oversight. Federal data shows that one out of every 9 nursing homes in the nation has not received a comprehensive annual inspection in 2 years. Infrequent annual inspections have led more residents and families to file complaints, which states are failing to investigate in a timely manner. Time is of the essence when state inspectors need evidence to prove serious deficiencies, like physical abuse, sexual assault, or inadequate medical care in circumstances like we've all read about. My fear is that the trail is going very cold for too many residents before nursing home inspectors can arrive at the scene. The findings of this investigation should serve as a wake-up call to Congress, both the House and the Senate. The investigation found that 32 state survey agencies have vacancy rates of 20% or more, 20% or more among nursing home inspectors, and 9 of those agencies have vacancy rates of 50% or higher. States directly linked staffing shortages to inspection delays and said flatlined federal funding over the last decade is making these problems much worse. Simply put, federal dollars are not keeping up with growing workloads and the need for states to offer competitive salaries to attract workers. Today, the federal government is spending tens of billions of dollars on nursing homes, but Congress appropriates less than 80 cents per resident per day on nursing home oversight, not even enough to buy a cup of coffee. For too long, Congress has failed to invest in strategies to protect the health and safety of the nation's 1.1 million nursing home residents. If we as Americans claim that ours is the greatest country in the world, we must insist upon and invest in and ensure that we have the best long-term care system in the world. That should be our goal, and we're not fulfilling that goal right now. And I'll now turn to Ranking Member Braun for his opening remarks.
Thank you, Mr. Chairman. For the first time in U.S. history, older adults are expected to outnumber children by 2034. As our population ages, we are facing growing health care workforce shortages. I've dealt with that before I came to the Senate in a different arena. Indiana has 4,300 job openings for nurses and is projected to need 5,000 more by 2031. Nursing homes have not been spared from these shortages, leading to issues with patient care and overall quality. My home state has worked to address this issue. A law championed by Ivy Tech Community College and the Indiana Hospital Association removed limits on nursing school enrollment. Ivy Tech partnered with nursing homes to offer paid apprenticeships. Last month, I went to a rural high school, and they have a program for students to earn a CNA. We need to do a lot more of that in high school, where the education is the best value we get, and before they get outside of the system, we need to have programs there, career and technical education, that lead you into places that may not need more time and more money. I've also introduced the Prioritizing Evidence for Workforce Development Act, which prioritizes funding for evidence-based workforce programs. The federal government should make it easier for people who are looking to work, not more complicated, especially in healthcare. Instead, excessive federal rules and regulations pose barriers. We got to have regulations, some guardrails, but not to where they become oppressive. And I've witnessed that in running a business over the years and being aligned with a state government that I think finds a little better balance. President Biden is expected to propose an overtime rule, for instance. In my own company, that was $35,000 at one point. I think it was adjusted up a little bit, but taking it up to $80,000, that will dislocate so many jobs in the people that would want something at a lower level, but you got a kind of a crazy federal recommendation there, and that is what goes above and beyond. This would make nursing home workers subject to overtime regulations, reducing staff flexibility and quality of care. As an employer, I dealt with the administration, the Obama administration's overtime rule myself, and know the obstacles it created in my own business. As we work to build up healthcare workforce, we must do more to improve transparency and accountability. 2021, we spent $181 billion on nursing home care. However, nursing home cost data is not readily available. Transparency is lacked in so many places in commerce throughout our country, and a lot of it has to do with government regulations, or at least they're being for it. More transparency is never bad. Sent a letter to the National Center for Health Statistics asking to improve an important long-term care survey that runs every 2 years. Currently, the survey does not ask about nursing home costs. So I've asked to add new questions to that to bring that out into the forefront. Federal government is required to conduct annual surveys of nursing homes, which is vital. It just needs to be done, I think, more thoroughly and with full transparency. CMS incorporates survey data in developing 5-star quality ratings, which are displayed on the website Care Compare. I am developing a bill that would make Care Compare more accessible. I'd like to recognize the majority's report. Think there for that as well. Over the past 2 years, nursing home inspection rates have been unacceptable. COVID policies contributed to some of these delays. Nevertheless, we got to do better. So much of healthcare comes at that stage in life. I agree with some of the recommendations in the majority report. We need to improve Care Compare and expand the healthcare workforce. I look forward to working with the chairman to accomplish these goals.
Thank you, Ranking Member Brunn. Now we'll turn to our witness introductions. I want to start with Erin Bliss. Ms. Bliss is the Assistant Inspector General for Evaluation and Inspections at the Department of Health and Human Services Office of Inspector General. She has been with the OIG's office since 2000. Our second witness is Shelley Williamson. Shelley Williamson is the President of the Board of Directors for the Association of Health Facility Survey Agencies, which represents state survey agencies across the country. She's also the administrator for the Section for Long-Term Care Regulation with the Missouri Department of Health and Senior Services. Our third witness is Leah McMahon. Leah McMahon is the director of the Colorado State Long-Term Care Ombudsman Program. Ombudsmen work to resolve problems related to the health, safety, welfare, and rights of individuals in long-term care facilities. Now I'll turn to Ranking Member Braun to introduce our fourth witness.
Dr. Susan Liu is the Gerald Lyles Rising Star Professor of Management at Purdue University's Mitch Daniels School of Business. She is also affiliated with the Regenstrief Center for Healthcare Engineering at Purdue University. Her research centers on healthcare operations and analytics with an emphasis on nursing home operations. Received her PhD in managerial economics and strategy from the Kellogg School of Management at Northwestern. Dr. Liu's work has been widely recognized by a number of popular media outlets, including Nature News, Vox, Freakonomics, and Barron's. We're delighted to have you here today.
Thank you, Ranking Member Braun. Now we'll turn to Ms. Bliss for her opening remarks.
Good morning, Chair Casey and Ranking Member Braun. Thank you for the opportunity to discuss the strains to the nursing home inspection system and the impacts on nursing home residents. Decades of OIG work has found that alarming numbers of nursing home residents are subject to low-quality care or unsafe conditions. The bottom line is this: people in nursing homes need a robust and effective inspection system to protect their health and safety. In some cases, their lives depend on it. But OIG has identified lapses in that system that put residents at risk. State survey agencies' responsibilities are vast and consequential. They are on the front lines, conducting inspection surveys for more than 15,000 nursing homes. State agencies assess nursing home quality and safety, investigate complaints, identify deficiencies, and verify that nursing homes correct those deficiencies. However, state agencies too often fall short in fulfilling those responsibilities. A predominant issue is that many states fail to conduct timely surveys. This is a decades-old problem worsened by the COVID-19 pandemic. States are required to do comprehensive surveys for each nursing home at least every 15 months, but nationally, about a quarter of nursing homes are overdue for these vital surveys. States must also do surveys to investigate the most serious complaints about nursing homes within a certain number of days, but many states have repeatedly missed those deadlines too. Backlogs in routine and complaint surveys can have real consequences for residents. On average, states cite almost 9 deficiencies in health standards per survey. So delays in surveys mean delays in identifying and fixing risks to resident and even actual resident harm. This is very concerning, as serious complaints commonly involve allegations of poor care. In one example, a complaint alleged that a resident with known high blood sugar did not have glucose testing strips available and then died. Other serious complaints involve allegations of patient abuse and neglect, poor conditions at the facility, and infringements of residents' rights. But states face some real challenges. States have pointed to staffing shortages as a driving cause for survey delays. Similar to the chairman's report findings, we have heard going back for years that states struggle to attract and retain surveyors who are typically nurses. For example, in 2018, Colorado cited its vacancy rate of 32% as a cause for its late surveys. States have pointed to long hours and not being able to offer high enough salaries to compete for nurses. State agencies have also faced increasing numbers of complaints requiring on-site investigations. The persistence of state agency performance problems raises questions about the Centers for Medicare and Medicaid Services, known as CMS, which oversees state survey agencies. How effectively is CMS able to drive improvements? They have relied primarily on corrective action plans and training to try to improve state agency performance, but these efforts often did not resolve the problems. CMS's processes for validating survey results reported on the Public Care Compare website are also inadequate. Last month, OIG reported on inaccuracies in state survey results shown on Care Compare for an estimated 2/3 of nursing homes. In conclusion, an effective survey process and transparency into its results is crucial for protecting nursing home residents. OIG is committed to driving improvements in this safety system, as well as other aspects of nursing home performance, resident well-being, and oversight. We have recommended ways for CMS to strengthen nursing home oversight and are engaging with them to drive positive change. Thank you for the committee's support of OIG's work and the resources that we need to protect people in nursing homes and other HHS programs. Thank you, and I'll welcome your questions.
Thank you, Ms. Bliss. Ms. Williamson, you may begin your statement.
Good morning, Chairman Casey, Ranking Member Braun. I am here today representing the Association of Health Facility Survey Agencies, or AFSA, the organization that represents survey agencies across the country. I'm also the administrator of the Section for Long-Term Care Regulation in Missouri, which oversees 511 certified nursing homes in the state. Like many survey agency managers and directors, I have spent most of my working life dedicated to protecting our country's most vulnerable citizens. For me, my grandparents were a driving force from the day I decided to pursue a graduate degree in social gerontology to becoming a nursing home surveyor, a manager, and to my role today. 4 of my grandparents have relied on nursing home care. This work is personal to me. I understand firsthand why the work of a surveyor is so important to residents and families. Protecting health and safety is the cornerstone of survey agency work. Our work is important and rewarding, and our work is hard. Our surveyors are the face of our work. They talk to families upset with care, to facilities concerned with the citations they receive, and they see the joy on resident and family faces when our work creates real, meaningful change. An example of this dedication is a recent survey at a nursing home in Missouri. Our surveyors started their day early one morning and identified deficiencies that could have likely resulted in serious injury or death if we had not intervened, what federal regulations call immediate jeopardy. The surveyors remained in the facility until midnight that night, ensuring they had an acceptable plan from the facility to remove the immediate jeopardy. Surveyors were back on site to continue the survey the very next morning. Our work is not 9 to 5, Monday through Friday. Surveyors spend many nights, weekends, and holidays away from their families and loved ones. Across the nation, this is the type of protection survey agencies provide every single day. With workload increases, including a 102% increase in the number of immediate jeopardy complaints since 2015, and increases in the severity of deficiencies cited, survey agencies are reacting to alleged noncompliance rather than being proactive by conducting recertification surveys. Vacancies in nearly all survey agencies are having an impact on the ability to respond timely to complaints and to complete recertification surveys. Nearly 70% of survey agencies have surveyor vacancy rates over 10%, with many reporting closer to 20 or 30%. Registered nurse salaries in over 80% of survey agencies are not competitive with the healthcare market. An increase in the federal budget is necessary for survey agencies to rebalance, to improve retention of existing surveyors, and to recruit new surveyors. And with a growing number of Americans expected to need nursing home care in the coming years, it's imperative to increase the federal budget now and to sustain that increase. Nursing home residents are our parents and grandparents, aunts and uncles, brothers and sisters, friends and loved ones. They are the generation that molded many of us today. They deserve our respect, our compassion, our dedication, and our protection. Thank you for the opportunity to provide this testimony and for your support in ensuring nursing home residents receive the care they deserve. I welcome any questions you may have.
Thank you, Ms. Williamson, and thanks for sharing your own story about starting as a surveyor. Ms. McMahon?
Good morning, Chairman Casey, Ranking Member Braun. I am the Colorado State Long-Term Care Ombudsman, and thank you for the opportunity to appear before you today. Last year, my office received a call from a family member who reported concerns about their loved one living in a nursing home. The ombudsman met with the resident, and the resident reported regularly waiting hours to receive assistance after requesting help from the nursing home staff. The ombudsman observed the resident crying while they reported that the nursing home staff yelled at the resident often, refused to let them out of their room, and physically shoved their wheelchair while forcing them back into their room and then slamming the door shut. The resident also reported an instance of a staff person who pulled their hair, took away their phone, physically shook them, and left the resident in the bathroom after assisting them to the toilet. The resident requested the ombudsman to file a complaint to the state survey agency. A year later, the ombudsman received a call from the surveyor stating they were investigating the complaint. The ombudsman informed the surveyor that the resident moved out due to abuse and neglect. It was too late. The family later informed the ombudsman the resident suffered from night terrors due to post-traumatic stress disorder. This is unconscionable, and one example of many my office has received over the past couple of years. This person lives with a disability and suffered abuse at the most vulnerable time in their life with the greatest need at this time in their life. Imagine if this was your family member, your sibling, or you. It takes courage for residents and family members to file a complaint. The fear and real threat of retaliation by nursing home staff is a concern on the minds of residents. Therefore, when a resident or family member finds that courage to file a complaint, it is critical that there is timely follow-up. The nursing homes have their equity firms, their trade associations, their lobbyists, their attorneys. The residents, the lucky ones, have family, and the rest of them have us. As the Colorado State Long-Term Care Ombudsman, I represent the interests of approximately 45,000 vulnerable adults and people with disabilities who reside in licensed assisted living homes and licensed nursing homes in Colorado. My role is to coordinate and oversee the Ombudsman program and provide systemic advocacy for residents. The nationwide long-term care ombudsman program, authorized by the Older Americans Act, is an independent health oversight agency that advocates for the interests of long-term care residents. We are in nursing homes at residents' bedside every day, listening to the concerns of residents and their families and advocating on their behalf. I would like to highlight to the committee my concern about the impact of the staffing shortages among long-term care surveyors. The state agency is responsible for licensing, surveying, and regulatory oversight of long-term care facilities. In Colorado, nursing home surveyors have incredibly challenging jobs, which are made more demanding by agency staffing shortages. I have great appreciation and respect for surveyors and the survey process. I know from speaking with the Colorado State Survey Agency, there are difficulties in maintaining adequate survey staffing levels. The state agency needs to offer competitive wages to hire surveyors, and training new surveyors is time-intensive and can take up to a year. I see firsthand the impact these shortages have upon nursing home residents and their families. Residents and family members have complained to my office about waiting long periods of time for a response after filing a complaint, and at times have not received a response. Additionally, the Ombudsman program has filed complaints with similar experiences. In March 2021, a local ombudsman was in a long-term memory care nursing home and observed several instances of abuse and neglect. This included a staff member yelling at a frail elderly resident and residents laying in their own urine and feces. This is a clear violation of resident rights. The ombudsman called the state agency's complaint line, and they did not report back for 1 year after the complaint was filed. This delay can have a negative impact to the health, safety, not for just one resident, but all residents. I know surveyors are working as hard as they can to be responsive to resident complaints and concerns, but it appears there's just not enough survey staff. These shortages place residents at a significant risk of harm and even death. The survey agency is the only entity with the authority to enforce standards that facilities meet regarding the quality of care and services residents receive. Thus, it's important for CMS and state survey agencies to have the necessary staff and resources to conduct annual surveys and to respond to complaints in a timely manner. The Colorado Office of the State Long-Term Care Ombudsman Program recommends increasing funds to assist state survey agencies to hire and retain nursing home surveyors to meet the workload, offer competitive salaries for required nursing surveyor positions, which could be the most difficult positions to fill, and maintained within the regulatory agency. Create dedicated recruitment and training positions to hire and train new surveyors. I appreciate the opportunity to appear before the committee and for your time and attention regarding vulnerable adults who live in long-term care nursing homes. I look forward to answering your questions.
Ms. McMahon, thanks very much. Dr. Liu, you may begin.
Thank you, Chairman Casey and Ranking Member Brown, for granting me this invaluable opportunity to testify the regulations and operations of nursing homes. My name is Susan Liu from Purdue University. As the only child in my family, I have always pondered, how can I provide the best care to my aging parents? In my quest, I recalled an old saying from my cultural background that emphasizes treating the elderly with the same respect and care as if they were my own parents. So, hence, this motivated me to focus my dissertation on nursing homes, dedicating nearly 2 decades of research of this industry. And over time, helping the elderly to receive high quality of care became the very mission of my life. My expertise lies in the fields of economics and operations management, where I was trained to maximize social welfare, minimize cost, and optimize resource allocation. By understanding the impact of policies and technological advancements on nursing home behavior, I'm pleased to provide my expertise in 3 key areas: quality disclosure, staffing, and ownership. First, publicly disclosing quality information of individual nursing homes is crucial for the elderly to find the home where they love to stay. The Center for Medicare and Medicaid Services have made commendable efforts in making quality information transparent, and these actions have proven to be effective. Going forward, we aim to increase public awareness of those disclosed quality information and find an efficient way of communicating those valuable data to consumers, help them to make informed decisions. Second, the ongoing challenge of staffing shortage significantly affect nursing homes' operations. To effectively tackle the shortages, it is important to explore innovative ideas and have access to comprehensive data on individual nurses. Third, there has been increasing concern about the potential downsides of ownership change, including the acquisition by private equity firms. However, rigorous research in this area is limited. It is critical for us to recognize the potential risks associated with ownership changes and implement targeted oversight to protect the well-being of nursing home residents. Today, I stand before you as an expert in nursing homes, ready to offer insights into potential strategies that could incentivize nursing homes to improve the quality of care they provided. I would like to extend my sincere appreciation for your leadership and unwavering commitments to address the needs of old adults. In conclusion, I express my utmost gratitude for the opportunity to be here, and I hope that we can work together to create an environment where nursing homes not only provide excellent care, but also serve as compassionate and reliable sources of support for our aging population. Thank you.
Dr. Liu, thanks very much. I think our panel set a record for time used in their opening statements. well below the time you had, and I appreciate your efficiency. I'll start my questions for, I have a question that will go right down the panel. The committee's investigation found that severely understaffed survey agencies are falling behind on nursing home inspections and complaint investigations. Ombudsman provided examples of serious complaints involving abuse, neglect, and poor health care going months or longer without being investigated. I'll start with Aaron Bliss and go down the panel. And this is kind of a basic yes or no question. Are you concerned that understaffed survey agencies and delayed inspections negatively affect both health and safety of nursing home residents?
Yes, very concerned.
Yes, absolutely.
I agree, absolutely.
Doctor, thanks very much. I'll next turn to Ms. McMahon. Your testimony highlighted examples of nursing home residents suffering when complaints went unanswered by strained survey agency staff. And our report shows that ombudsmen across the country similarly identified how residents, the care of residents, I should say, suffered as state surveyors were unable to respond to complaints in a timely way. How would nursing home residents benefit from improved survey agency staffing, as well as more regular annual inspections, and third, faster response to complaints?
More oversight, more regulatory eyes on the conditions of the nursing home and the residents' care.
And what do you think is the best way to effectuate that?
To make sure that the survey agencies have enough surveyors to do the work. It's a heavy workload, it's long, exhausting days, and they need help so that they have competent surveyors who are trained and skilled to do this exhaustive work.
Thanks very much. Ms. Williamson, I wanted to turn to you. According to the report that we've released this morning, more than 30 states expressed concern to the committee about federal funding levels for nursing home oversight. 3 presidential administrations, the Obama administration, Trump administration, and Biden administration, have proposed increasing funding for these survey agencies in their budgets. However, Congress has not has not had enough of a focus on this funding, effectively freezing much of the funding for the last decade. How would more funding help survey agencies better protect both health and safety of nursing home residents?
Thank you for that question, Chairman Casey. An increase in funding would allow survey agencies to recruit new staff, retain existing surveyors, to be able to respond to both complaints that we receive and to conduct recertification surveys. State agencies are finding themselves now utilizing many of their resources to respond to complaints that we received. Overall, since 2015, complaints have increased by 45%. And as I highlighted in my testimony earlier, the most serious complaints have increased by 102%. So we're spending a lot of resources responding to complaints. The recertification surveys are very, very important. Those are a comprehensive look at all of the regulatory requirements, and that often creates or results in identified issues before they become so severe that they harm residents. So more funding would allow us to both respond to complaints and to conduct those recertification surveys in a timely manner.
I wanted to highlight that number that you made reference to in both your opening and then just a moment ago, the 102% increase in immediate jeopardy complaints, and that's just since 2015, correct?
That's correct, yes.
That is very alarming. And in order to keep the streak going within our time, I'll turn now to Ranking Member Braun.
Thank you, Mr. Chairman. I'm going to start with Dr. Liu, and it has to do with the overtime rule. And I'd like Ms. Bliss to weigh in on it as well. So that's a tricky way in terms of compensation for anyone. Yet it is generally an agreement between an employer and an employee that seems to be the best working model. Under the Obama administration, it was $23,000. And simply, if you had any type of arrangement that was over or not at least there, you had to take in overtime into consideration. Their ideal was taking it up closer to $50,000. During the Trump administration, it actually moved to $35,568. Biden administration, and a lot of the stuff coming out of the Labor Department, is actually proposing that as $80,000. So across almost all disciplines, that would disrupt tons of relationships between employers and employees where they both mutually agree that that's okay at whatever that amount is, as long as it meets that minimum threshold. What do you think would happen in the nursing home business if, for those that are on a salary, all of a sudden you had to take that up to $80,000 from $35,000? How many jobs would be lost? And I think that would cut both ways. Employers may not be able to afford it. Employees may not even demand it. So give me your take on how it would apply to nursing homes.
Thank you, Senator Brown. Regarding the payment on the overtime issue, actually, it's beyond my study, the scope of my study. But I do have a paper investigate the impact of mandatory overtime laws on nursing home quality. So initially, I actually really like this policy. Hence, we want to evaluate this policy. However, to our surprise, we find that this well-intentioned policy leads to quality decline in nursing homes. And it took us more than half years to figure out why. And eventually, we found that such type of overtime regulation leads to undesirable staffing changes. And the nursing homes substitute the full-time nurses' overtime hours with those hours from temporary nurses, from outsiders. And those contract workers actually are not very familiar with the nursing homes they are going to work for. They even don't know the names of the elderly. So hence, it caused the problem. So that's the research finding in my work. Yeah, thank you.
Thank you, Ms. Bliss.
Thank you. Unlike Dr. Liu, we have not directly studied the impacts of overtime policies, so I don't have a basis to comment on that directly, but what I can say is that understaffing in nursing homes is a dire concern. We have seen some nursing homes not even meeting the barest minimum of requirements of having 8 hours of registered nurse staffing in a day. And that's extremely alarming. So certainly any policies that support getting sufficient numbers of staff, sufficient quality of staff into nursing homes. We have heard some concerns from nursing homes that Dr. Liu referred to regarding challenges around contracted nursing, and we'll have forthcoming reports speaking to those.
I think that it's probably something you need to all have on your radar, because every particular component of our economy has some degree of it. And remember that So if it's too low, you're not going to get people there. If you take it too high, you're going to shed jobs. So as tough as it is to get people to work in the arena you're concerned with, just be aware of that. Ms. Bliss, I'll stick with you on this. When it comes to training, I'm a big advocate that we're wasting the time in high school to direct parents and kids into career and technical education avenues. Indiana, 135,000 jobs, double what it was pre-COVID, need no further training. They need better life skills. What is the best way to get more people interested in working at a nursing home? Does it have to have something post-secondary, or can we do better at maybe doing some things when they're crafting what they want to do after they get out of high school?
Thank you for that question. The pipeline of nurses and other clinical support staff going into the field to be able to even staff these jobs is a huge issue that comes up. So there are questions of low pay, long hours, longevity, but there's also questions of, are there even enough people to hire if we can offer those things? So the pipeline is really important to keep building. We have heard from nursing homes that challenges involve both staffing of nurses, registered nurses themselves, as well as nursing aides, which may require, lower degrees of training.
So what I was asking, though, that is a symptom of the system. And would it be better, and do you think there's adequate attention to the place where, as a CEO and a company, where I never had any issue hiring four-year degree slots to fill. In fact, we've gotten rid of most of those requirements. The place I found most lacking would be life skills taught in high school that would apply to a broad array of jobs, and apprenticeships, part-time jobs, summer jobs, even where you might need a little additional training. So I think we're out of time here. We may come back to that, and I can expound on that in the next. Okay, so you want to look at it from that point of view. What about using those years where you're wondering, are you going to go AP? Are you going to go into something that maybe needs a little bit of training? When I went to school, you had all those skills being built, and we've pretty well gotten away from that. So you want to come back and offer any more on it?
Sure. Certainly starting early, reaching out to people in high school and even in that early education seems like it could be very important to building that pipeline, attracting them to go into the health professions, nursing and otherwise, providing opportunities for those skills. So it's not something that we at the HHS-OIG have directly studied, but I think all options need to be on the table to deal with the workforce crisis.
And I can tell you that in a state like Indiana, with one of the lowest unemployment rates in the country, biggest manufacturing state per capita, how we're dealing with this is not necessarily from here. It's through our states and getting the industries, these sectors that are struggling with people coming into whatever they need. They're starting in middle school, trying to have stuff in high school so that you're not so dependent post-secondary on how you get employees. Thank you.
Thank you, Senator Braun. As many of you know, you've heard me say this before, that Thursday morning is a busy morning around here. Lots of competing hearings and that command the time of senators. So I just wanted to mention senators who've been here and then some who have been here and then returned. Senator Blumenthal was here. Senator Warren was here and is back. Senator Kelly, Senator Rick Scott, and Senator Vance. And I think in terms of just going back and forth, I'll turn to Senator Warren, then Senator Vance.
Thank you very much, Mr. Chairman, and thank you both for holding this hearing today. It's a very important hearing. Nursing homes are where the most vulnerable members of our communities live. It is our duty to ensure that they are safe, but some of these facilities are in horrendous condition due to the greed of their corporate owners, and it is families that end up paying the price. Private equity firms have targeted nursing homes for decades, and now new investment vehicles, real estate investment trusts, or REITs, are in the game too, snapping up nursing homes as lucrative investments. For these profiteers, their interest in nursing homes has less to do with providing care to those in need and a lot more to do with money. Now, research shows that private equity and REIT-owned nursing homes are associated with higher Medicare costs, increased emergency department visits and hospitalizations, fewer registered nurses, and 40% higher COVID mortality rates. Regulators need to be able to hold nursing homes accountable for patient safety, but corporate owners use all kinds of tricks to avoid identity. Ms. Bliss, it is the job of the Inspector General's office to investigate waste, fraud, and abuse in nursing homes to make sure that residents are safe and taxpayer money is being used wisely. How easy or hard is it for your investigators to identify the owner of a private equity or REIT-owned nursing home?
Thank you for that important question. It can be very difficult to identify nursing home owners and management and really uncover who are the responsible parties to be held accountable when something goes wrong. That's something that comes up in our oversight and our enforcement cases.
Okay, so hard to enforce the law if you can't figure out who's on the other end of this. So the way this gets so tangled up is that private equity and REIT owners set up these complex legal arrangements to avoid transparency and to try to evade responsibility when something goes wrong. And also, by the way, to make money. One trick is that when the company that owns the nursing home also has a stake in another company that sells supplies and services to the nursing home. Now, Ms. Bliss, the Inspector General's office is looking into this issue, which is known in government language as related party payments. If a nursing home owner is making money on both sides of a transaction like this, do you have concerns about whether or not taxpayer money is being used wisely?
We do. We have concerns about the use of taxpayer funds, and we have concerns about the impact on the residents in those nursing homes. As you noted, we do have ongoing audit work that is looking into these arrangements and payments. They're often called related party transactions, where the nursing home is making payments to contractors with whom it may have some financial stake. And we're looking at whether those payments may be inappropriately inflated and potentially diverting funds away from patient care.
Okay, so it's really important that taxpayer funds be protected, and I appreciate your work on that. But of course, the main thing too is we want to make sure that patients have a safe, healthy place to live. Ms. McMahon, you are a state ombudsman, which means you are on the front lines when it comes to identifying and preventing problems in nursing homes. So can you tell us what trends you've noticed when a for-profit company, such as a private equity firm or a REIT, purchases a nursing home?
Thank you, Senator Warren. I have observed firsthand over the years, and typically what we see is staffing cuts, in particular nursing staff, which are critical to the health, safety, and welfare of residents. The Ombudsman Program will see an increase in complaints from families who report the inadequacies of care and their concerns when they visit their loved ones in nursing homes. Residents who are bedridden and develop open wounds because staff are not changing protective undergarments, they are languishing. They're not receiving their medications timely or as prescribed. They're not getting basic needs such as food or water. Due to these types of concerns, residents become dehydrated, they lose weight, endure painful bed sores, oftentimes the size of your hand that can happen. This can lead to hospitalization and, in worst cases, death. We see a fast deterioration and systematic stripping down of the operations of the facility to the bare bones to make a profit at the expense of residents' lives. Residents go from thriving to just surviving.
Yeah. That's a terrible list. And I just want to say to both of you, to all of you, I appreciate the work you're doing in trying to keep nursing home residents safe. The Affordable Care Act requires facilities to disclose ownership and related party information, but the nursing home industry lobbied furiously to make sure that these provisions were never implemented. In February, the Biden administration took a step to change that. I urge CMS to finalize its proposed rule on ownership disclosure to ensure that consumers can make informed choices and so that regulators have the information they need to hold these owners accountable and to keep patients safe. Thank you, Mr. Chairman.
Thank you, Senator Warren. Senator Vance.
Thank you, Mr. Chairman, and thanks to you and the ranking member for holding this committee hearing. As Senator Warren said, it's a very important hearing, and any of us who have known or love someone in a nursing home knows that while the care that they get when it's good can be quite exceptional, that when things do suffer, it really, really affects the quality of life for those who are sometimes languishing in our nursing homes. And to your point, Ms. McMahon, surviving instead of thriving, and that's not what we should want for any of our elderly folks. So I would sort of two lines of questioning, and I would direct it at Ms. Williamson here. One, just on my understanding here is that staffing shortages play a major role in what's driving the lack of inspections and probably driving a lot of other issues in our nursing homes as well. But we'll sort of understand the basic qualifications here. So when we talk about the people doing these inspections, what qualifications do they need to have before applying to a job with your particular agency?
Thanks for that question, Senator Vance. So there are several different disciplines of surveyors, but the primary thing I would like to talk about is that when we do a recertification survey, and many of our complaint investigations, our recertification surveys, and those require a registered nurse. Every survey team has to have a registered nurse as part of that team. And then if the complaints are about quality of care where nursing assessment needs to be conducted, a registered nurse has to conduct those investigations as well. We do utilize other disciplines. Part of our survey process is also a life safety code survey or a fire safety survey. So we have to have surveyors who are trained and have that background in order to assess compliance with those regulations. Many other disciplines are social workers or physical therapists, other disciplines outside of that registered nurse. But the primary struggle states are having is in registered nurse.
I see. And how big are the survey teams normally? You mentioned each one needs to have at least one registered nurse. I mean, are these teams of 10, of 5, of less or more?
So the team size depends on several factors: how large the home is, how many residents are in care at the home, the numbers of complaints that we may have to investigate during that survey, and then how much travel we have to do,
Sure.
how many resources we have to take. Normally, a team of 3 or 4 over a work week is average for a recertification survey.
Got it. So moving on from there, I just wanted to ask about maybe a possible COVID hangover effect. And I'm right that a lot of the backlog here is because we effectively stopped doing inspections for a few months during the COVID pandemic. That's correct?
That is certainly a contributing factor.
Okay. And are you seeing any evidence of sort of a potential COVID hangover effect? And what I mean, of course, is that we just declared an end to the emergency, I think far too late, but at least the declaration happened a week or two ago. Is there any sense that the people who would be doing the inspections or maybe a little exhausted, a little overwhelmed, certainly by the pandemic, but also even well after the pandemic had reached its emergency phase end, were affected by a lot of the requirements and a lot of the regulations that existed on caretakers and inspectors related to the pandemic rules?
So while the pause certainly was a contributing factor, we have also seen a significant increase in number of complaints that have been reported to us. I mentioned earlier the number of immediate jeopardy complaints since 2015 has increased by 102%. So those are the complaints where residents, allegations are residents are being harmed, severely harmed. So investigating those complaints day after day does lead to exhaustion and
Sure.
burnout and stress on surveyors.
Sure. And I suspect, just to close here, that the caregivers themselves are probably exhausted, and as you lose the best caregivers, it probably increases the complaints you're going to get because the underlying quality of care deteriorates. And the final point I'd make here, and I appreciate, Ms. Williamson, your answers, and I appreciate the four of you for being here with us, is, look, COVID was obviously a very terrible pandemic. I don't mean to make light of it or make light of the fact that it killed a lot of people, but I also think that we have to balance the public health response with the incredible stresses that we place on a lot of our public health and hospital and nursing home caregivers, because a consistent theme that I get is that COVID was miserable, but also all of the surrounding things that were placed on us because of COVID, or at least allegedly because of COVID, were also miserable. And I think we lost a lot of good people in our healthcare industry. So we're going to have a pandemic, God forbid, but we will eventually. Hopefully it's many, many years from now. But I hope we learn the lessons and don't overstress our healthcare system again, because I think you all and certainly other parts of our healthcare system are dealing with the consequences. Thank you.
Senator Ricketts.
Great. Thank you very much. I want to thank our witnesses for being here today. Obviously, we've got a lot of people across the country that are in skilled nursing facilities, and we've got to be able to make sure that we protect them. Everybody probably has a family member that is going to be impacted by this, if not currently, at some point in the future. And in my home state of Nebraska, I know that one of the issues we've had has been with regard to staffing and making sure that our nursing facilities are staffed appropriately. And there's a lot of different issues, especially in rural areas, that can impact that. As governor, we actually provided a 15% increase in funding for nursing facilities to be able to, which was like the most significant increase they had had in probably a decade, to be able to help fight that. We also put a tax credit in place for caregiving expenses designed to improve the financial and workplace security of family caregivers. But this continues to be an issue. We've had, as we have skilled nursing facilities and assisted living facilities close, one of the issues they relate to is staffing. So, Dr. Liu, you know, could you, I know you've got a lot of data and research that you've done with regard to staffing on this. What sorts of conclusions or recommendations can you give us around effectively proactively combating nursing shortage? What are some of the things that states can do? Are there models that you would suggest? Or there's somebody who's really getting it right that we could look at and say, hey, here's a good model of something we should be replicating?
Thank you, Rick, for raising this staffing question to me. So I firmly believe that we needed to rely on technology advancement. So we have the staffing shortage issue. I know, I understand that, say, raising salary, increasing the working environment, they are good ideas, but they have other consequences. But I do aware of two types of technology advancement may help, according to my research. The first one is the adoption of healthcare information technology. So according to the research, we found that in a 12-hour shift, the hours a nurse spent at the bedside, patient bedside, only 2.5 hours. And the remaining huge amount of hours are wasted in walking on the hallway and something else. But healthcare information technology could help to improve the utilization of nurse hours. The second technology I'm aware is kind of nurse sharing platform, which is something like a Uber, car sharing. So our team now is working with those type of platforms. They try to match nurses with those healthcare facilities and improve the efficiency of those of using the idle time of the nurses. So I hope that in the near future, we could rely on the technology to help to solve the staffing shortage. Yeah.
Are there any regulations or red tape that the federal government puts in place that would enable CMS to dedicate more attention and resources to oversight of nursing homes?
So, of course, more resources are better, but I, as a person training in economics, I care more about how to optimize the allocation of resources. In other words, how we can use the resources efficiently and effectively. That is a more important issue in my mind. Yeah.
So I've got just about a minute left, but I'm going to ask every one of you just to, if you've got something to talk about this. One of the things I'm concerned, and it gets back to what Senator Vance was talking about with the pandemic, is one of the things we saw in Nebraska was having the residents be isolated. That, you know, there was a lot during COVID of wearing masks, you couldn't see people's faces. They used to have, you know, meals together, and then that got discouraged because we didn't want to, and then I'm not sure we've gone back to getting people back together again. I'm really concerned about the loneliness of our residents of skilled nursing facilities. And I mean, the other things, Ms. Mahan, you were talking about are obviously very important too, but here's one I think is maybe not getting enough attention, which is our residents in skilled nursing facilities getting enough social interaction. So it's not just about taking care of their physical well-being, but also their, you know, mental well-being and, you know, having a life where they actually have interaction with other people. Just, each of you just real quickly, Ms. Bliss, we're going to start with you. Just give me a comment real quick on what you think about what I'm talking about here regarding the loneliness and personal interaction and what we can do and just how we might address it.
Sure, yes. Well-being of residents in all dimensions, including social and mental health, is critically important. I think that's a challenge worth focusing on.
I thank you for the question. You know, during the pandemic, one of the things that I didn't say in my response to Senator Vance was our staff went in to nursing homes with outbreaks going on to do focused infection control surveys. So we did see the isolation that was there and just the struggles that the residents and their families, because they couldn't visit, were experiencing. I think things are slowly getting back to what our new normal is. There are still some areas where people need to be mindful, but communal dining and activities and those things are starting. Visitation is much more open now. So those are all very good things that are happening. Did the isolation and loneliness take a toll? Yes, it did.
And are there things that we can be doing to encourage the facilities getting back to more normal, to encourage that? Like those activities, the meals, all that.
I think the ending of the public health emergency and some of the restrictions that were in place being relaxed is a good first step. I think more groups meeting and talking about the importance of those social and interpersonal relationships. Yes, care is very important, the physical care, but those other things are just as important. I think the more we can highlight that and talk about that and encourage that, that will only improve.
Yep.
Thank you, Senator Ricketts. Residents suffered helplessness and loneliness to the highest degree during the pandemic, and folks were locked in their rooms, all alone. And it's time for us to get back to having social opportunities for residents, in particular around meals. That is where they come together every day to see their friends and to visit and talk over a meal. And I think one of the things that we continually need to address are the nursing home staffing shortages so that we can get back to those activities and facilitating that for the residents. The ombudsman have seen firsthand that the activities are still lacking and are not quite what they should be.
Thank you.
Thank you.
Dr. Liu, do you have any comment?
I don't have comment on this issue. Thank you.
Great, thank you. Senator Braun?
Thank you, Senator Ricketts. We're going to have some other senators roll in here, I think, soon. I'll fill the gap. Got a question for Ms. Williamson. I ran a business for 37 years in a place like Indiana. Senator Ricketts was in charge of a state. There's this constant dialogue about where do we craft the best solutions for issues like this and who pays for them. Since I've been here, this place is going the wrong direction in terms of running its own kind of finances in a way that would be sustainable for all the places that look to it. You know, we're running $2 trillion deficits currently, up from $1 trillion. It's been both sides of the aisle that have not managed the federal government in a way that puts so much in peril. With these issues, and I'm pretty certain on staff shortages, that's probably something better addressed by states, because they're going to know what they can do. Doesn't necessarily mean they'd be the only ones, but where do we craft the solutions best in your mind, and how do we pay for them best over the long run? And should we be looking at a difference in, you know, where the relative emphasis has come from to date? That's kind of a broad question, but I think it is really relevant because we're dealing with that same question on so many issues in the country.
Thank you for that question. And yes, nursing home residents are our most vulnerable citizens, so I think they deserve adequate protection, and that's what survey agencies do. Survey agencies do receive a combination of federal and state funds, so it is a combination. So I think it's imperative that both.
So which form of government, though, from here down to the grassroots, or states, and not all of them will necessarily get it right, where do you think the relative emphasis ought to be shifted to if we're going to actually solve these problems and pay for them in a way that is going to be sustainable?
So I think it's a combination. The federal has to allocate resources, and states have to allocate resources.
Do you think it should move one direction or the other, or just stay the way it is?
I think it's both, because when survey agencies go do an inspection, it is for certification purposes, Medicare and Medicaid certification purposes, and it's also for state licensure purposes. So that there is that share there. States recently have increased their budgets to fund surveyor salary increases because of the shortage. So that is falling on states now because we don't have that increase in federal funds.
Dr. Liu, would you want to weigh in?
Yes. So first of all, I like the idea to increase the annual income for surveyors because they provided the fundamental information for quality disclosure. However, I think there are lots of ways to increase their income in addition to raising pays. So here I propose one potential idea from my own perspective. So I think we can collaborate with those colleges with nursing education programs and give the money to them and let them to hire some state surveyors to train or mentor those undergraduate students or graduate students as a part-time surveyor, or provide exponential learning on those survey courses. And the students can be allocated with those tasks which do not require specified or, say, high skills. For example, they can check whether the floor is clean, whether nurses wash their hands between care. These are the dimensions in the state survey programs. So by doing so, students could get great learning experience and open the new door to them, let them get interested in the healthcare system. Maybe potential surveyors will be there in the future. And also surveyors can get more pay by teaching. They can earn the extra money by helping those students doing mentoring services. And those education programs also can benefit from it. At least they can increase the quality of their program by providing such kind of exponential learning. And our federal government and the state government could also benefit from it. It can help to solve the surveyor shortage issue, and also, I would say, efficiently allocate the resources. So each party can be better off. That's my idea. Thank you.
Thank you.
Thank you, Ranking Member Braun. Ranking Member Braun, thank you for filling in as I was running between committees. Appreciate that work, and thank our witnesses. We'll now turn to Senator Blumenthal.
Thank you. Thank you so much, Mr. Chairman, and thank you to the ranking member, Senator Braun, as well. And thank you for all of the input that you're providing today. I am very, very grateful to the chairman and ranking member and also the staff of this committee for the work that it is doing on this really critically important topic. With all of the issues that are facing us today that are in the headlines, sometimes the most important work doesn't get the attention that it deserves, and this work is among our most important, uncovering the need and the consequences of oversight and scrutiny in this area is very important. I look forward to reading the investigative report that uncovers the staffing shortages, high turnover rates, and flat federal funding for the last decade that has resulted in insufficient oversight of the nation's nursing homes and threatened health and safety of their residents. Yesterday, the permanent subcommittee, Permanent Subcommittee on Investigations held a hearing on Medicare Advantage, another area of health care where there's a need for greater scrutiny. And I think that some of the facts that have been uncovered by this investigation will be relevant to the work done there. And again, the Office of Inspector General, Ms. Bliss, has been very, very instrumental in that area as well. I would like to ask Ms. McMahon, beyond health care, beyond care, compare, what do you advise families searching for a nursing home to do to ensure that they have all the relevant information they need to make an informed decision on what nursing home is best for them?
Thank you, Senator. I would say call my office. We certainly can direct folks to other resources as to where, as to what they should look into. We oftentimes will tell folks to go to the survey agency and look at the most recent survey. And we will talk about the things that, as the Ombudsman program, the things that they can ask of specific facilities as they are looking to provide the best quality of care and life for their loved one.
Let me ask you, just for you and maybe for the other witnesses, when families regret what's happened to a loved one, what do they wish they knew before choosing a facility? In other words, you know, regret is probably one of the most important emotions that we have with respect to loved ones when it comes to health care. What do they wish they had known?
Thank you, Senator. And we're talking about transparency. We're talking about potentially wanting to know staffing levels, how many nurses are in the building at any given time, who is the medical director that is overseeing and coordinating the overall care, and maybe any instances of abuse and neglect that have happened prior to. I think those are really important things to know.
Ms. Williamson, and thank you for that answer. Ms. Williamson, your testimony touched on the issue of contractors. And I wonder if you can tell us, first of all, maybe elaborate a little bit on which states do well with contractors, which do not, and what lessons state, and particularly state officials, ought to learn from the experience you've had.
Thanks for that question. I did touch on contractors because more and more states are relying on them to complete particularly recertification surveys and some focused infection control surveys. Each state's contracts are a little bit different, and the work that they have contractors do can vary. I can speak on behalf of Missouri. We do have contracts for contract surveys. Primarily for us, those are the recertification surveys, the healthcare portion of the recertification survey. We have used them not as extensively as other states. They've done about 15 or so surveys for Missouri. We have had pretty good luck with the surveys that they have done. We have ongoing communication with the contractors when they're doing the survey, particularly if they're finding issues that are serious, just to make sure that they're thoroughly investigated, that the state agency agrees with the citations that they're issuing. We also do a review on the back end of their survey to make sure that they're applying the regulatory requirements consistently with what we would do. Each state's experience is a little different. I can't speak to other states and their experience. I know the report highlights some different experiences. I don't have firsthand knowledge of that. I can just speak from Missouri, but I do know more and more states are relying on contract surveyors just because of the staffing shortages we have.
I think more than half the states now rely on private contractors to do this kind of oversight and certification.
That is correct.
And Connecticut actually is considering hiring a contractor because we've been unable to fill our vacant positions that were created during the pandemic, but it's a critical job, and it's kind of going to be garbage in, garbage out if we don't kind of oversee the quality of the contractors who do the certification. We don't certify the certifiers, so to speak. That's a vastly oversimplistic way of looking at it, but I think it's a very important area, and thanks for your input. Thanks, Mr. Chairman, for letting me run over my time a little bit.
Don't worry about it. Senator Blumenthal, thanks very much, and we'll turn next to Senator Gillibrand.
Thank you, Mr. Chairman and Mr. Ranking Member. This is an excellent hearing and one very needed for my state of New York. The Centers for Medicare and Medicaid Services require every nursing home to designate a medical director as responsible for resident care coordination of medical care. CMS does not have a compliance mechanism for this legal requirement, however, and nursing homes are not required to submit the identities of their medical directors to CMS. Ms. McMahon, if nursing homes were required to report their medical directors to CMS and state survey agencies, would this be a helpful tool for Ombudsman to hold nursing homes accountable and effectively advocate for residents?
Thank you, Senator Gillibrand. I do believe that requiring nursing homes to report their medical directors to CMS and state survey agencies could increase quality of care in nursing homes. As you noted, the regulations place great emphasis on the role of the medical director and requiring them to implement resident care policies and coordinate care. Often medical directors are absent from the nursing home for long periods of time. It is rare that you will see a medical director physically in a nursing home. This is sometimes due to the medical director overseeing several nursing homes in a chain. By increasing accountability for medical directors, it could ensure they are fulfilling their critical obligations under the regulations. And when that doesn't happen, ombudsmen have another tool to take to the survey agency as a concern. And again, this ties back to increasing the surveyors for the state survey agency.
Well, it doesn't sound right, though, that a medical director would have to oversee 8 facilities. Don't you think they should have to limit how many facilities they have under their care?
I absolutely agree with you.
And what limit would you put on it?
I think it would be hard to pick a number because you have to take into consideration how many residents are in a specific facility in each building.
So maybe no more than 100 residents per medical director? Like, would you do it by that basis?
I think that's a good way to approach it.
Well, to the extent any of you have a recommendation on that, please submit it by letter to the committee. So have some thought about it, because I think some individual responsible for 8 facilities obviously is not doing a good job. It's impossible to have that level of oversight if you're spread that thin. So I'd like your recommendations there. And are there any ways that medical directors can increase transparency and accountability within nursing homes? To anyone. Go ahead, Dr. McMahon, or Ms. McMahon.
Thank you, Senator Gillibrand. In my experience, again, it's a rare situation where residents even know the medical director of the nursing home, and further what the role is of the medical director that they play actually in the nursing home. By increasing transparency, residents will be able to interact better with the people who are responsible for implementing the policies and care. Increasing the participation of the medical directors in the facility operations would add additional safeguards and protections for nursing home residents.
Thank you. In 2021, New York Attorney General reported that the number of nursing home residents who died from COVID-19 was undercounted by as much as 50% compared to data from the New York Department of Health. The investigations revealed that facilities that had lower pre-pandemic staffing ratings had higher COVID-19 fatality rates. Ms. Williamson, the New York State Attorney General report revealed a lack of compliance with infection protocols led to increased risk of harm for nursing home residents. How could better compliance with standard surveys improve outcomes in nursing homes, and how can increased staffing standards improve compliance with surveys?
Thanks for that question, Senator. As far as increased compliance and infection control is one of the most frequently cited deficiencies that survey agencies cite. Pre-COVID and since COVID. That regulatory requirement has a lot of different elements to it, but it is one of the most frequently cited deficiencies. During the pandemic, our staff focused on conducting focused infection control surveys to assess compliance with infection control standards, and we continue those today. So I think increasing our ability to do recertification surveys will catch some of those lapses in infection control before they harm residents. So that is very important to us, and one of the things that we are struggling doing with the increased volume and the surveyor vacancies that we have. So that's a very important aspect of our work that we hope to be able to do more of with an increase in resources to do so.
Thank you very much. Thank you, Mr. Chairman. I have a question for the record based on investments in home and community-based services. I'll submit.
Senator Gillibrand, thanks very much. I just have one more question, and then I think we'll close. And I appreciate our witnesses' testimony today. Ms. Bliss, I wanted to go back to kind of the basic function of the office that you're a part of, the independent watchdog function, which is so vital in government as it is in any other endeavor. That work has never been more important or frankly under more pressure in recent years. Last week I met with the nation's inspectors general to discuss how oversight can improve accessibility for people with disabilities under federal information and services. Today you've highlighted how your office's critical work on nursing homes is so essential for us to examine, and it's an issue I know that Inspector General Grimm considers a top priority. How can Congress best help your efforts on a number of fronts, but in particularly to help improve nursing home care as well as to tackle other pressing issues?
I really appreciate that question, and in fact, improving nursing home care and safety is the #1 priority for Inspector General Grimm. We are investing heavily into this area, but our resources are really strained. We have about 2 cents for every $100 spent by the Department of Health and Human Services. So we have a vast and incredibly complex mission that's incredibly important to the people that the programs serve. We make difficult decisions every day about what oversight work we can and can't get to, what enforcement cases we can and can't investigate. The President's budget request for fiscal year 2024 includes an increase of $52 million specifically for our Medicare and Medicaid oversight. And so certainly an increase like that would expand our ability to better protect nursing home residents and to expand our work looking at care for residents of nursing homes with disabilities and people with disabilities outside of nursing homes and across other HHS programs.
Well, thanks very much. And in the interest of time, we'll move to our close. I'll just have a closing statement, then I'll turn to Ranking Member Braun. 37 years ago this week, the Aging Committee held a hearing to examine the state of nursing home oversight, which was chaired by Pennsylvania Senator John Hines, who was then the chair and a leader on this issue. At that hearing in May of 1986, the committee heard about the critical need to adequately fund nursing home inspection agencies and how not doing so would have, quote, grave consequences, unquote, for quality care. We heard similar warnings today, and these warnings must not be ignored. Here's just 4 steps the committee should work on going forward, and I would argue not just this committee, but multiple committees in both houses of Congress. First is, of course, funding. Congress must prioritize the nation's 1.1 million nursing home residents by investing in oversight, as, I'll say it again, the last 3 presidential administrations have proposed. Second is transparency. The investigation makes clear that CMS needs to track and report survey agency staffing, given that staffing is a leading indicator of a state's performance. Third, protecting taxpayers. States, CMS, and independent watchdogs need to closely examine the use of contract inspectors and make sure that proper guardrails are in place. And finally, fourth, workforce. The investigation shows that expanding the healthcare workforce will help healthcare providers deliver better care and ensure that states conduct better oversight. The Aging Committee's oversight in the 1980s paved the way for landmark nursing home reforms that President Reagan signed into law. Today's hearing and the committee's investigation provide another opportunities to find common ground to make sure nursing home residents are kept safe and receive the care that they and their families deserve and have a right to expect. I'd like to thank the witnesses for their thoughtful and expert testimony today. You've helped us to diagnose the problem, to set forth those problems as well as solutions that we will examine going forward. I'll now turn to Ranking Member Braun for his closing remarks.
Thank you, Mr. Chairman. And again, we've had a good discussion. You can't legislate through this committee, but a lot of discussions happen here that then do get legislated through other committees. So I think it's clear from what I've heard, we need to improve transparency and accountability. I look forward to working with Chairman Casey to do this. Both of our offices have had a knack for, I think, finding common sense solutions and putting it into law. I stressed earlier, don't make things worse by federal rules and regulations. The overtime rule was one. We had a discussion on it. I can tell you that in almost all other arenas, you got to be careful there because it went from just 27,000, which was too low during the Obama administration. They wanted to change it. It went to a level where it was an uproar in terms of the number of jobs that would have been lost, where places just couldn't probably afford to do it. And now the current administration is talking about going up nearly to 80,000. And it'd be great, I guess, if you could afford to do it, but it would completely disrupt employer-employee relations across the country. So how we sort that out remains to be seen. On other extreme federal overreach, we have had to weigh in as a freshman Senate office, and when we do, it was generally on an issue that made sense because something was fixed on account of it. We had a little discussion earlier, too. Do these solutions get crafted here in a place that is not evidently ever taken Finance 101. So many places depend on it, and we increasingly borrow more and more money to support the programs that so many people look to. It's not a good long-term business plan. Something's got to change, and I think until we actually start doing budgets and doing things that would give more confidence to the American public that we are going to craft solutions and pay for them sustainably, maybe look to the rest of the government marketplace, which would be states that actually have to live within the regimen of not borrowing from future generations and have an equal responsibility and might be in better place to actually affect them and do it in a sustainably long-run basis. So the one thing I think we can agree on, this is a big issue. I'm going to be here as a partner with Chairman Casey to see what we can do. And again, thank you all for weighing in today. Much appreciated.
Thank you, Ranking Member Braun. I wanted to note for the record the scale of a report like this, as you can imagine, takes many, many months of work. Peter Gartrell, right behind me over my left shoulder, and his team put untold numbers of hours into this report. It gets to page 89, and I think the footnotes, Peter, go over 440, something like that. So it's a pretty big report. We had the stack of documents here, which I won't lift up to show you, but it requires a maximum effort by our staff, and we're grateful for that, and grateful that Ranking Member Braun and his team are here with us today to talk about this. I want to once again reiterate our gratitude to each of the witnesses for bringing not just your testimony and the answers to questions, but in each of your cases, a lifelong or significant period of your life's commitment to these important issues. Nothing could be more important. No work could be more important than making sure that we're providing the best care to seniors. If any senators have additional questions for the witnesses or statements to be added to the record, the hearing record will be kept open for 7 days until next Thursday, May 25th. Thank you all for participating today. We're adjourned.